Welcome to the GIE Endoscopy Author Interview Series. I'm Dr. Abel Joseph from the Cleveland Clinic main campus. On behalf of myself, my esteemed co-authors, and especially my mentor, Dr. Amit Bhatt, we offer our appreciation to GIE for allowing us to share our research in this issue of GIE Endoscopy, titled Outcomes for ESD of Pathologically Staged T1B Esophageal Cancer, a multicenter study. The management of esophageal cancer can be challenging due to its intrathoracic location. Surgery can result in significant morbidity and mortality. Many elderly patients are not optimal candidates for surgery. In patients with T1A tumors, which have a low risk of lymph node metastasis, endoscopic management with endoscopic resection has caused a paradigm shift. However, in patients with T1B esophageal tumors, it's somewhat of a watershed area. Some patients will suffer metastatic disease, but others will not. So we asked ourselves, is there a role for ESD in T1B tumors? In our study, we wanted to gather information not only on technical outcomes, but also relevant clinical outcomes of T1B resection in esophageal cancer. Given the rarity of pure T1B disease treated with ESD, we performed a multi-center retrospective study of pathologically staged T1B esophageal cancer. We included patients who underwent ESD of T1B esophageal cancer at 7 academic tertiary referral centers in the United States and Brazil. We then analyzed the patient and procedural characteristics, including follow-up data. We reported that ESD for T1B esophageal cancer had en bloc resection rates of 92%. Interestingly, our R0 resection rate, which is defined as no cancer at the margins of the resected specimen, was only 52%. We then looked at the 74% of patients who did not undergo surgery immediately after resection and actually went on to surveillance. 10 patients had ESD resection within curative criteria, and no recurrences were seen in the 13-month follow-up period in these patients. 39 patients had non-curative resections, of which 5 patients developed metastatic recurrence and 5 patients developed local recurrence. We then performed a univariate analysis and found R1 resection had a higher risk of recurrent disease with a hazard ratio of 6.25. We concluded that EUS staging of T1B esophageal cancer has poor accuracy and staging ESD should be considered in these patients. We also reported ESD R0 resection rates are low in T1B esophageal cancer, and R1 resection is associated with recurrent disease. Patients with non-curative ESD resection of T1B who cannot undergo surgery should be surveyed closely, as recurrent disease was seen in 25% of these patients. Our next steps are to see if retraction techniques can improve R0 resection rates in T1B esophageal cancer. We're also interested in studying the role of adjuvant chemoradiation therapy in prospective studies. We are available and happy to answer any questions regarding this study. Thank you for watching.